Hey everybody, welcome back. It's Dr. Matthew Hurt again with Center Chiropractic in Boalsburg, just outside State College and Penn State University. Today I want to show you and talk to you about extremity adjustments. And first I'd like to introduce and thank my friend Emily Wiggins for her help with this today. Emily is a really beautiful person. She's a doula, which is a birthing assistant here in State College, and she is a person who has an incredibly gentle and nurturing strength about her, which are two qualities that if you're looking for assistance and support through the process of giving birth to a child and bringing it into the world, those are the kinds of qualities I think you want. So she's also a great listener and just a pleasure to be with. She's a lovely person. So if you need help with your birthing process, look her up. So really when we're talking about extremities, or what we also call the appendicular skeleton, what we're talking about are any joints outside the spine. So that can include the frontal or maxillary sinuses, it can include the septum for deviated septum issues, the temporomandibular joint, the TMJ over here, either end of the clavicle, the collarbone, as it articulates with the sternum or the shoulder joint itself. Sometimes, not very often, rib heads will misalign with the sternum here. Then of course there are elbows, wrists, hand bones, finger bones, hip, knee, ankle, foot bones. So there are a lot of joints really here, probably more all told than you have in the spine itself. But I've seen a whole host of issues relate to misalignments in these areas. I mean, something as simple as the TMJ being out of misalignment because you use that joint so much with chewing and talking. Not only can you get grinding and clicking and popping in there, it can cause dizziness, it can cause headaches, there are all sorts of problems that relate to that. Lots of adhesive capsulitis and frozen shoulder issues relate to shoulder misalignments. I think I already mentioned deviated septum. You can get sinus headaches if your sinuses aren't draining properly. Tennis and golf elbow, carpal tunnel, sciatica can relate to extremity adjustments to a degree. So this can really involve a fair amount of pathology and discomfort. So it's a really common thing in my office to work on these. I would say in any given day, probably 75% or more of our visits involve adjusting some extremity joint. So what I want to do today, because there are so many of them, is just kind of give you an overview of some of the most common ones so you have a feel for what to expect if you have problems in these areas and you're thinking about coming here for treatment. So the first one I want to show you, which kind of makes sense in terms of presenting them logically in a video, is probably not the best one to start because it's an awkward adjustment and it can be a little tender. It has to do with that temporomandibular joint, the TMJ in here. And there are a couple different ways to adjust this joint. The most common one, the easiest one for most people, involves you, the client, sitting in a chair facing a mirror. And we have a mirror on the wall over there, but because of the setup for the camera here, we're not really going to do that today. I'm just going to mock up this adjustment for you. And what's first done is first we determine which side has misaligned. It is almost unheard of for both sides of the TMJ to misalign. Once we know which side is misaligned and which side we're going to adjust back in, I stand behind the chair with you relaxing against me like this, and I'm going to just contact the jaw here with both my hands. And while I'm watching your jaw track in the mirror so I can see how it's moving, I'm going to have you open your jaw and then just very gently and slowly close it as I gently guide that misaligned side back up into the bone on the skull. So it's a little bit more tender than that usually. I mean, anybody who's had a TMJ problem, you know that can be a pretty ouchy area. That's a technical clinical term, by the way. So next what I want to show you are shoulder misalignments. These are very, very common in here. I see very few people. I think it by and large has to do with how much we sit down these days. You know, most of us don't have that nice Greek statue posture anymore. We've got kind of the rolled forward potato chip posture. Puts a lot of stress on these joints. Again, there are a couple different directions of misalignment possible with the shoulder joint. The most common one, in my experience, is when the upper arm bone, the humerus, drops down and forward with relationship to the part of the shoulder blade that it meets up with here. So in this adjustment, again with you sitting comfortably and me standing behind, I'm going to put a little bit of gentle pressure on the back of your shoulder blade and the front of your arm bone to try and start to get it to move back into the correct position. And I'm just going to slowly cycle that joint through a couple ranges of motion here, which will start to help it move into the right place. And about the third or fourth turn there, I'm going to bring your arm in front of you. I'm going to reach around here, and what I'm doing is I'm stabilizing your shoulder blade against my chest here because I want to move that upper arm bone up and into the shoulder blade. I don't want the shoulder blade to move. So I get you in the proper anatomic position here with the palm facing the face, and then it's just a very quick, shallow adjustment up into place there. So that's the most common shoulder adjustment. They all don't look like that. To be fair, it's also one of the most tender ones. So here I started off with the two worst ones. If you made it this far, you're going to be fine here. So as I mentioned, there are several different kinds of elbow misalignments that can occur. They can relate to tendonitis. They can relate to golf elbow or tennis elbow. So do know that those exist, but we're not going to work on those with Emily today. What I want to show you here is an adjustment that is probably almost as common as breathing in here, even more common than the shoulder adjustment, and that is the adjustment of this first metacarpal head. It's the top of the thumb bone where it attaches to the side of the hand here. This, again, is under stress because of how much we sit, how much we work on computers these days. So I'm actually going to adjust her first metacarpal on this visit because this is a common one for her. She had a little wrestling match with a bus a few months ago that she lost, and so we've been working on this one a lot. So in this case, the head of that metacarpal has moved up and forward. So I'm going to contact it in such a way where I can set it back and down. So I'm going to take a little slack out of the joint there, and I just have Emily really let that arm relax. Just let that go sound asleep. We're just going to set it right back in. So I wouldn't be surprised if you actually even heard that there. So that's pretty much it for the upper body. Again, there are other adjustments in there, but they're rare enough and awkward enough it doesn't make sense to show them to you, and this is just an overview. So what we're going to do now is take a break for a second, have Emily move over to the other bench, and then I'll show you some lower extremity adjustments. So again, with lower extremities, primarily what we're talking about is the hip, that big ball and socket. We're talking about the knee, which really involves 4 different bones. We're talking about the ankle or the foot or the toe bones. In all honesty, I very rarely see a ball and socket in need of adjustment. Those kinds of problems are usually more related to low back or pelvic misalignments. Also, with the exception of trauma, I don't think I've ever met a knee problem that started in the knee. Again, outside of trauma, surgery, that sort of thing, knee problems almost always start in the ankle or they start in the low back or the pelvis. So out of all the adjustments you can do in the lower part of the body, where I find myself doing most of the work is in the toe bones and in the ankle bones. So again, this can relate to any kind of tendonitis, neuritis, any of the kinds of things you can get with the upper extremity. I've even seen things like Morton neuroma clear up with adjustments in the toes here. So there are really 2 most common adjustments I do down here. The first one is a lot of women who professionally wear high heels find that these front toe joints get really sore. They feel bruised most of the time. They're really tender. Sometimes even once they get home and take their shoes off, you know, they still have a lot of tenderness in those joints. So these are pretty simple adjustments. We're just pushing the heads of those metatarsals back up into place here. And I'm just mocking this up because Emily doesn't need every joint in her foot adjusted with every take that we do here. So that's a pretty common and pretty straightforward adjustment. The most common one I do in here is really the joint between the leg bones and the talus. The talus is really the connection between the leg and the foot here. If you think about what's going on in this area, it's actually pretty cool. The weight of your entire body, which is vertical up until this point, all of a sudden transitions into an angular force going forward to the ball of your foot and backward to the heel of your foot. So there's a lot of stress on that joint. Not to mention switching kinds of shoes every day, so your body doesn't know what kind of foundation it should expect, or running or wearing high heels, all those other kinds of stresses that we add. So you've got these 2 big leg bones that come down on the outside that make the ankles, little ankle bumps here that you're used to, and then the talus sits right up inside and it rocks back and forth. It's what gives you that pivoting movement. Usually when it misaligns, it either misaligns forward or it misaligns forward and down. It's not necessarily a more common misalignment, but what I'm going to show you here is the one for when the talus moves straight forward, when it moves anterior. And again, like a lot of these, it's a pretty simple adjustment. What we do is, first of all, make sure this is where we need to be, that this is stuck, that it's not related to a lumbar or pelvis adjustment. We actually need to adjust this joint. I'm going to contact the front of the talus here with both thumb tips. I'm going to grab the foot here, and while I pull down a little bit on the back of the heel to kind of use that as a lever to help the talus slide back into place, I'm just going to give a little gentle push back and down and set that right back into place. So that's pretty much it for the most common lower extremity ones. Again, there are a lot of variations on all these adjustments. I just want you to have a sense of familiarity and a picture in your mind of what can go on with some of these. It's hard for me to imagine with this general video that you don't have some sort of question about this. So you can either post your questions below this video, I'll check back in regularly and answer those for you, or you can email me at the office or call me during my lunch break for a free, no obligation, no cost consultation. please wander around our website, check out the blog, subscribe to our free email newsletter, or you can just call our awesome staff at 466-2000 to set up your first appointment. Whether you're in pain and you're trying to get out of it, or whether you're trying to avoid it before it happens, you'll be glad you did. Thanks for your time, and blessings to you and yours.